Right, I'm live on my Facebook. I've got to be honest. Jackie, you'll back me up on this. I've been doing this for a while, and I have just logged in on Instagram, and at the top where it says the live thing, there's two other people, presumably that I follow, doing live things at 7 o'clock on Tuesday. Now, I am the OG, and I suspect they are taking my followers, because that might account for the fact that it's just you and me, Jackie, and Corinne has just joined. Because it used to be just me on a Tuesday night 7 o'clock. I never saw that before. Now two other people going live on a Tuesday at 7 o'clock. I mean, they do say imitation is the sincerest form of flattery, so I am going to take it in that vein. That due to the overwhelming success of the Ask JJ Q&A, that everybody and his uncle is out there doing likewise. Anyway, if you are tuning in to this one, you are with the person who started it all back in the day, and I've got some questions to be answering. If you have a question that you want answered, fire away and ask. What's the worst that could happen? I'm going to kick off with this, if that's okay. This question says, how soon after breast augmentation can you fly? Now, what I normally say to this question is it depends why you're flying. So if you have a breast augmentation and then something happens the next day that you've got to fly somewhere because there's a family emergency or something like that, you can fly the next day. There is nothing that's going to go off in the airport lounge that's going to sort of say, oh, she had surgery. And in fact, people do this. They fly, they go to, overseas to have surgery, and then they come back shortly afterwards. So that you can. I wouldn't particularly recommend it for two reasons. Number one reason is that you will have a higher risk of DVT. DVT are clots in your legs that can fly up into your lungs, and they're a risk during immobility. When you have surgery, you're immobile, and when you're on an aeroplane, you're immobile. So you're multiplying your risks if you travel in an aeroplane shortly after having surgery. So you're increasing your risk of DVT, and that is what happened to Usher's wife. She travelled to South America for some cosmetic surgery. Anyway, she got a DVT. So that is one reason not to have surgery. And the other reason, I suppose you could not have surgery. You could not have surgery, but what I'm saying is you should not fly. That's one reason why you should not fly. And the other reason is that if you have a problem, so, it takes a while for everything to settle, swelling, wound, blah, blah, blah. You don't want to be going off to Marbella and have a problem in Marbella and say, look, my wound's a bit red. And we're like, oh, have a look. We'll give you some antibiotics. And you're like, I'm in Marbella. So so it's not advisable is the answer. So the normal thing that I say is 6 weeks. And I normally say it depends on what you're flying for. If you're going on a holiday or things like that, at 6 weeks, you'll probably still be a bit sore. You'll probably still be a bit swollen. They probably won't look quite right. So, it won't be fully there. So it'll probably be 3 months before things start looking a bit more presentable. So 6 weeks I would say is the minimum for normal circumstances. But as I say, there's nothing to stop you flying at any time, depending on. But 6 weeks is the advisable time. Now, what we got, Corinne, you are the OG. Thank you. Take it as a compliment. I do. It's a compliment I gave myself. Lorena is here, US stateside. Yo, spud me, Lorena. Missing you terribly, Lorena, and we have got stories to tell you when you get back. Oh, yes. But for now, I'm not going to say anything, and I'm going to let you enjoy your holiday. But suffice to say, everything's fine. Everything's fine, Lorena. Don't worry. It's all fine. Add you, James. Price of lipoma removal, please. Add you depends on size. Can you send us a photo of it to give you an idea of price? If you go to the website and you click on the request a price, you will get sent some information. If you give me your email address, I can send you some information. I think, I don't want to get this wrong, so don't quote me on this, I think it starts... Does it? Lorena probably know. I think it starts at 800. I think. That's definitely what it is for moles, but I don't know if that's for lipomas. Anyway, send us a photo, info@staianoplasticsurgery.co.uk. We'll have a look at it and give you a bit more of an accurate price. But thank you for asking the question. Indeed. Do you have a liquid rhinoplasty? Liquid rhinoplasty. That sounds good, doesn't it? Liquid rhinoplasty. No, I don't do rhinoplasty, and presumably, I'm presuming this liquid rhinoplasty is kind of like fillers, changing the shape of the nose with fillers, which is a reasonable thing to do, indeed. But no, we don't do fillers, and we don't do rhinoplasties. Put the two together, what do you got? We don't do liquid rhinoplasties. That's what you got. So no, but it does sound good. I like the sound of liquid rhinoplasty. Is that a term they're using now? But if it is, I like it. Sam's in the house. Hi, Sam. How are you? Nice to see you in a virtual way. How about this? I had a breast reduction about a year ago, but unfortunately there were complications and I ended up losing my right nipple. Do we offer nipple reconstruction? Yeah, that's not my patient, by the way. Not that. Nipple loss. I mean, nipple loss can happen to anyone. And full disclosure, it has happened to me. It's many years since it's happened, but it has happened in my life. And it is a complication of breast reduction and indeed mastopexy. It's never happened to me for a mastopexy, but it has happened in a breast reduction. It's usually for a very large breast reduction when you're moving the nipple an awfully long way because the blood supply of the nipple can be affected. So that's something that I do warn everybody having surgery that's a risk. And it's difficult to fix. I'll be honest with you. Normally, if you have a problem with nipple, blood supply to the nipple, you have a little bit of depigmentation of the nipple in that it's paler than the normal areola skin. And normally tattooing would be the way to go. And that would probably be my advice here. I don't know this patient. I don't know what it looks like and what sort of degree of nipple loss there has been, because there are degrees of nipple loss for breast reduction. So, but having said that, even if it's total nipple loss, tattooing is not an unreasonable road to go down. They can do these 3D tattoos, so to give the effect of some projection in the middle of the areola to make it look like a nipple. So I think the tattooing is probably where I would be going. You can do nipple reconstruction, and I used to do a lot of nipple reconstruction when I worked in breast reconstruction, which was after cancer, and I was doing nipple reconstructions all the time because as part of a mastectomy, the nipples were often removed. Now, but that's a different story, because when you've had a breast reduction, the nipple loss will be on a scarred bed. So it's a little bit more difficult to reconstruct the nipple on a scarred bed. And so the actual surgical reconstruction of a nipple is quite hard if you lose your nipple after a breast reduction. But, you know, one of those ones you can send us a photo and have a look. But that is something that is a tricky one. It's a tricky one. It's kind of possible, but my go-to would be tattoo. Website. Hi there. Please, can I have some more information regarding any information you have on BII? Yes. So, hi, Webster. So, BII is breast implant illness, and breast implant illness is something that is associated with breast implants. There's lots of different types of breast implants. It's pretty much all breast implants. People talk about it being related to the silicone, and even saline implants have got a silicone shell. So it's usually quite non-specific symptoms, things like brain fog, tiredness, joint pains, hair loss. It's quite skin rashes. It's quite non-specific symptoms. There is no medical reason to say that breast implants cause these problems. So there is no medical reason that links breast implants with these symptoms. So it's very difficult when someone comes saying they've got breast implant illness, because you can't guarantee that removing the implants will make them feel better. However, I have treated patients with breast implant illness, and they are absolutely convinced the implants are causing the symptoms, and you remove the implants and they feel better straight away. So it seems to be a thing. But at the moment, there's no medical link with breast implants and these symptoms. I say at the moment, something might come up next week, next month, whatever. Is there any relation to polyurethane implants? That may be the wrong material. Haha. No, polyurethane is the right material. There's no. Yes, there is a relation to there's a relation to all breast implants. I don't think any type of implant is what's the word, implicated any more than any other type. So I don't think you get breast implant illness in more in polyurethane or more in silicone. I mean, polyurethane implants are silicone implants inside with a polyurethane foam coating on the outside. And so I think it's just the same. So yes, it is in relation to polyurethane implants, but also silicone implants, smooth implants, textured implants, micro textured implants. So there's no specific type of implant that is implicated more than another type. So if you are kind of worried about it or feeling that it may not be a good idea, you're worried about getting breast implant illness, I think the advice would probably be don't have breast implants. I don't think there's any breast implant that is going to give you a lower risk of getting breast implant illness than another one. Having said that, it is not as common as you might think. If you look out for it, if you look on the internet, you'll find these huge groups of women who have been affected by it. Honestly, I've never seen it in any of my patients. I have treated patients with it who've had surgery elsewhere. So it's actually not that. I'm not saying there's anything different about how I do it. I don't think it's related to the surgery, but it just means it's perhaps not as common as you might think if you go looking for it, and you'll find huge numbers of women who describe it. But then you have to remember there are also huge numbers of women who don't have it. But nevertheless, it's one of the risks of having breast implants. So it's something you've got to put into the mix. Weigh it up, pros and cons. It's one of the cons, so it depends on what the pros are. If the pros aren't that high, maybe it's not so good. Thank you for the information from the people I've spoken to. It seems more psychological. Thank you for clarification. Yeah, I mean, I don't know. The other thing, I guess, is something, I think it's one of these questions. Yeah, here we go. Fat growth. Got that. The segues on to the next question. Look at that. Next question is, I'm planning on having either breast augmentation or fat transfer to my breasts, and I wonder if I'd need to come off sertraline prior to surgery. Oh, well, no, you wouldn't need to come off sertraline prior to surgery. That's absolutely fine. Most of your kind of normal medication when you're having surgery, I mean, always ask the question if you're on medication and check with everybody, the doctor and the anaesthetist and what have you. But in general terms, we allow you to have most of your normal medication. The only kind of medications we would be worried about, not necessarily even stopping, but just worried about, are things like blood thinners, warfarin or clopidogrel, things like that. That might be something that we'd be a bit worried about. Aspirin is also a blood thinner. Steroids, that's something that we'd be worried about in terms of healing. But most sort of normal medication is fine, and it's fine to take on the day of surgery. You obviously check with the starving times. If they've, you usually take some with a sip of water, and that's usually fine. But absolutely fine to have surgery. Oh, HRT and hormones are also a problem. HRT and oral contraceptive pills, some people ask you to stop those because of the increased risk of DVT. I don't, because of the consequences of stopping them. But I do warn everyone about the risk of DVT, and we do everything we can to minimize that risk. But going on to the question of fat transfer or breast augmentation, with your question, Webster, about the breast implant illness, that's something you might consider if you are concerned about breast implant illness. You could consider fat transfer. Unfortunately, I find in my hands and in my experience, fat transfer is not quite as good as we would like it to be. On paper, it sounds fantastic. Take some fat out of your stomach and inject it into your breasts. No worries long term about going hard or wrinkling or feeling the edge and all this sort of stuff. If you put on weight, you get bigger. If you lose weight, you get smaller. It sort of grows and with you. There's a lot of good things about fat transfer, really there is. And I loved doing it in the past tense, because I haven't been doing it for many years. I used to do it all the time in my breast reconstruction practice, because I was usually operating on one breast. But when you're operating on two breasts, when you've got to kind of split the fat between two breasts, and when you're operating on breast augmentation patients who are often quite slim and have a lack of donor sites, so they don't have an awful amount of fat to harvest, the results are often quite subtle. And the surgery is quite expensive because it takes quite a long time. And so I don't hardly ever, I would say never, but hardly ever do fat transfer for breast augmentation at the moment, because you're looking at probably less than a cup size. You're looking at 80 mils to each breast. 100, 120 would be a lot, and that's quite small in terms of volume. You could easily do a 250cc implant and just like that. And so for that reason, the fat transfer often has to be repeated. A lot of people say, oh, it sort of resorbs, so it has to be repeated. Not so much that it resorbs, although indeed it is quite swollen to start with, so it does start bigger then go down. But once it takes, it's there forever. But it is quite subtle, so you often have to repeat it, and it's quite expensive, so it's not quite as common as you might think it should be by rights. But Webster, that's what you could think of if you are worried about breast implant illness. I got 10 fine line simple flower tattoos a couple of weeks ago, and immediately knew I needed them off my body because they're so different to the idea I had in mind. Oh God. I got laser removal lined up, but because they are pink, blue and greens, I don't think it's possible. They're all no bigger and some smaller than 1 by 1 centimeter. I just wondered how long should I leave them to heal before surgical tattoo removal. Oh God, I think I might be wrong in saying this, but I think I have seen a photo of these, and I think they're kind of all over, and there's quite a lot of them. So I actually, although they're quite small, there's so many of them. I am unfortunately we're not allowed to show a photo, but I do recall seeing this. It was a little while ago, but because there's so many of them, they're not suitable for excision because I can't just make loads of little scars. It'll look like you've been through a windscreen. So it's just not going to look good at all, I'm afraid. And I completely understand the laser with the pink, blue and greens. Laser's not very good on colors, unfortunately. So, and just a couple of weeks ago, oh God, terrible. I feel for you, but I unfortunately don't think excision. This, to be honest with you, it's do get irate people with the tattoo thing, but I it's not all tattoos are suitable. In fact, not many tattoos are suitable. It's certainly the exception rather than the norm for the people who are suitable for tattoo removal. We get several photographs a day of tattoos, and I don't know exactly, but probably more than 90%, 95% of them are not suitable. So it's very rare to get a suitable one. So unfortunately, because there are small tattoos, but there are multiple, 10 of them, I don't think that's a suitable one for excision. I'm very sorry to say. Very, very sorry to say that. What's this? Please rate this chat. What is this? Oh, sorry. I'm looking at a chat thing. Right. Anyway, stick with the program. Stick with the program. Come on. Oh, God, I can't get rid of it now. If my implants have to be placed under the muscle, how severe will the pain be following surgery compared to over the muscle? Yeah, I mean, when people talk about recovery after breast augmentation, I usually say the same thing regardless of whether over or under the muscle. So I don't say it takes longer to recover when they're under the muscle. I say the first week you're not feeling too much, second week you're feeling better, computer stuff. After 2 weeks, lower body, 4 to 6 weeks for upper body. Same whether it's over or under the muscle. The difference is it is a bit more uncomfortable when they're under the muscle. No question about it. It is more uncomfortable. But I usually think, again, we need to get into graphs here. We need to do some graphs, yeah. We've got a bell curve. We've got a bell curve for pain over the muscle and pain under the muscle. So under the muscle is less painful. No, under the muscle is more painful than over the muscle. Right, so under the muscle should be here. So under the muscle is more painful than over the muscle, but the bell curves overlap. So some people have it on top of the muscle, but have a lot of pain. And some people have it under the muscle and don't have much pain. So it's an overlap. So yes, it is generally speaking more painful having it under the muscle, but there's not a gap between the bell curves. Yeah, the bell curves overlap. So it's not like some people you say, oh, under the muscle is fine, and they come and they say, oh, I've had it under the muscle and that was fine. There's no problems at all. Other people say, look, for goodness sake, over the muscle is really uncomfortable. It's really painful. So as generally speaking, it is more uncomfortable. Now, I wouldn't be using terms like how severe will the pain be. That's quite inflammatory, if you don't want me using those terms. So I would be saying it's uncomfortable. It feels weird. It feels tight. It feels odd, but hopefully pain is not a feature. Hopefully you won't actually be in pain as such. You'll just be uncomfortable, and it will, and you'll be like, oh crikey, I know I've had something done, oof dear, oof. But for both, I mean, it does feel a bit uncomfortable for both. Like even if you have it on top of the muscles, it's uncomfortable. So it's just a little bit more uncomfortable when you put it under the muscle. So yeah. So got to be honest, big up Webster for asking a question live. Big up Adu James for asking the price of lipoma removal. Admittedly, I didn't quite know the answer to that, but Webster's back in. Come on. If you train at the gym, are you more likely to experience a different pain/recovery due to having trained the chest muscle for years? Yeah. I do see people who have sort of trained the chest muscle, and and you do get people with, and often these are the people who need it under the muscle because they're often quite slim without much subcutaneous fat, which is the sort of person who needs it under the muscle. So and it can be quite thick, the muscle, so it can be quite a lot of muscle to divide, and that's going to be quite uncomfortable. It's going to bleed a bit more because the muscle can be quite thick. So paradoxically, yeah, it might take a little bit longer to recover if you have built your muscles up. I'm not saying don't build your muscles up. I'm just saying this is what it is. That maybe it'll take a little bit longer to settle if you have it. If you have the muscles, if you've worked the muscles and made them very strong, because they're often quite hard to actually sort of cut through. They're quite thick, so that can be a thing. Terry's in the house. Hi, Terry. Nice to see you. Hope you're well. I really do hope you're well, Terry. I know you've got a lot on. So I'm going to get an episode of Drive to Survive in. What you got, Webster? Would the thickness of the chest muscle affect the way the implant sits? Sorry for all the questions. Webster, can you not see? I'm dying for questions here. Hey, Terry. Would the thickness of the muscle affect the way implants sit? I would answer that question and say, if it all went well, no, it wouldn't. It would all be fine and it wouldn't matter. One of the risks of putting the implants underneath the muscle is you have to divide the muscle, and you divide the muscle up to the rib cage here, and up to sort of like the breastbone. And if you divide the muscle too much, then it can pull back and retract. And if you've got a very thick muscle, that could give you a prominent bulge in the upper pole. So that could affect the way the implants sit. It's a tricky one because if you don't release the muscle enough, then the muscle can hold the implant up high, and you can have a high riding implant, which will look odd. So you have to release the muscle enough, but not too much. But that's the problem with this job, absolute nightmare. When you do something and someone gets a problem, they're like, oh, you shouldn't have done it that way. You should have done less. You should have done it less tight, or you should have done it more tight. You haven't done it tight enough, or you've done it too tight. And you're like, well, yeah, you got a problem. So I wish I hadn't done it that tight, or I wish I'd done it, less tight, but or more tight. But at the time, you're always trying to make it perfect. But there's no kind of thing that tells us what perfect is, and there's always a risk of actually doing too much, and then that the thicker muscle could potentially cause a bulge. But as I say, if you get it right, no, I don't think the thickness of the muscle will cause a difference in the way the implants sit. I think the thickness of the chest muscle will just be what it is. It'll just sit on top of the implant, and you've already got your chest muscle there, so you just have an implant underneath it. But yeah, very good. If you want us to, yeah, it's a tough job, Webster. Tough job. Oh yeah. Yeah, there's enough to worry about. I wouldn't worry about the thickness of your muscle. I think that's, I would just try and get the implant that's the right sort of dimensions for you. That's what you need to look at when you look at choosing an implant. So I think that cup of tea and feet up are in order. Suggest you do likewise. I will be back here next Tuesday, I think. It's not a holiday, is it? We do a holiday? We must be do a holiday soon. King's getting married or something, isn't he, at some point next week? Or something's happening anyway. But that's on Monday, isn't it? So I will be back almost certainly next Tuesday. What's on the telly? You know what, Corinne? I'll tell you what's on the telly. Drive to Survive is what we're doing at the moment. I have been locked out of Antiques Road Trip. The girls have been watching Making the Cut, but I think they finished that now. So I think we've got a little bit of a respite. But I don't think I'll be. I haven't watched the Antiques Road Trip for many moons, but we are doing a bit of Drive to Survive on Netflix. We are loving it. I think we're series 3. So yeah, looking forward to a bit of that. Possibly, if everyone's up for it, I don't know. We obviously got to all be together. We can't watch it on our own. Got to get a whole quorum and school night. So Making the Cut. Yeah, well, I won't ruin it because I just heard who's won. But yeah. I do enjoy a bit of Making the Cut, but it's not really my thing. But I do enjoy it. Tan Francis is brilliant. He is brilliant. I've got to be honest. Very impressed with him. Right, so I will check out of here if that's okay. Jackie, loving